Hello everyone and welcome back to today's webinar. So today I want to discuss with you a very small case of mine, of a migraine of an 18-year-old female. And it's a very simple case, and I just want to give you an idea how I used to analyze a case in my practice, my day-to-day practice, how I used to analyze a case. So it's a very simple case. So let's start with the case right now. So what this migraine actually is? So migraine is basically a neurological condition that causes the multiple symptoms. It's frequently characterized by intense debilitating headaches. So exhaustion is there in headaches especially. Symptoms may include nausea, vomiting, difficulty in breathing, numbness or tingling, and sensitivity to light and sound. There's so much in this migraine cases. Especially nowadays I'm seeing a lot of cases of migraine, especially in teenagers, or especially in up to the age limit of 17, 18, 19. I'm seeing a lot of cases of migraine. I don't know why this type of cases. The major reason is probably the stress, work at home. Nowadays, the intense stress in the students, especially the teenage students, either they are trying to prepare for the competitive exam or something like that. Bright lights and sun glaze can include migraines and can as loud sounds. This also include headaches, and these are the major factors which can cause headache. A strong smell, including perfume, pain, thinner, second hand smoke, and others. These are some major causes of the migraine that we all know. So let's start with the case, and I will tell you the exact conversation what I got in this case. So this case of 18-year-old female. So let's start. Sir, I used to have severe headache in the vertex of the head. I really can't do anything with this type of pain. I really can't do anything. Even I had a lot of dandruff in my head. Those sticky dandruff is there in the head I saw. So what does it say? How does it bother you? I just want to ask, how does it bother you? How does it trouble you? I feel irritation all the time. So irritation for what? We have to go more deep now. As soon as someone asks me to do something which is really against my will, I get angry. When they repeatedly ask me to do things, I can do the work home. But when they repeatedly say, it get irritated. When they repeatedly used to say something to me, I get irritated. So what was the reaction after the irritation? I used to ask him. I used to reply them immediately. I immediately used to reply them. As soon as I reply them, I started weeping. After my anger, whenever I gave the reply, as soon as that I started weeping. So when does your headache aggravate? I just asked you, when does your headache aggravate? As soon as I touch my hair, even I slightly touch my hair, the pain aggravates. Slightly touch my hair, the pain will aggravate. And a combing of hair, even combing of hair, my pain aggravate, especially in the vertex and forehead. So I try to include the generalities of this case. It was a chilly patient, thirst wasn't that specific. So in this type of case, in this type of small case, how would you analyze a case that's itself a very big thing? How would you try to react to this case, and how would you analyze this type of case? So rubric which I took in this case was weeping, tearful mood, anger after vexation. Those are the major case. After the anger, immediately he used to weep. She used to weep extremely after the anger. And there is pain in the vertex which aggravates from a touch. As soon as touch anything, the pain in the headache is there. And there is lots of sticky dandruff in the head. Sticky dandruff that I took. And the headache, for touch of hair aggravate, even slight touch of head, headache aggravate. So pain in the head, combing, brushing of the hair aggravate. So these 5 rubrics I took, and only 2 remedies which are coming. One is sulfur, another is nitric acid. At this point of time, now the thermal, the generality, you can't speak any point in a case in this case. So I know that this patient was a chilly patient, and from the knowledge of my materia medica, I used to know sulfur is a hot patient, with a nitric acid a chilly patient. So what I prescribe? I prescribe nitric acid 30, OD for 5 days, and then after SL200. She did remarkably well after nitric acid 30. Just 5 doses of nitric acid, and she did remarkably well. So what I want to teach you from this case, see, we can't skip anything from the case, either generality, either particular, either mind. All are included in this case. In this particular case, the perfect example how we have to club up all the symptoms of either each field, either mind section, either particular section, either general section, or thermals and thrush specifically. We have to club them all, and we have to put it in the case, and we have to use them at the exact moment of the case where we can find the simillimum out there. So that's all I want to teach you from this case. I recently launched a book, The Acute and Emergency Management Through Homeopathic Therapy, with Dr. Raj Shimita. It's a very good book, and some of the very renowned homeopaths are giving very good review of this book, and I was so excited to make sure that you people are also liking it. So excited. So at last, I want to show reverence to all my teachers who taught me so much. You know, contact to me nishant25smilebox@gmail.com, and don't forget to subscribe to my channel.